Dr. Carson, you're a medical doctor, and I appreciate that. Confirmed cases in the United States over 1,000, 8 times the number just a week ago. At least 31 people died. Is that being contained?
Well, first of all, I think we will probably do much better as a nation rather than fighting over this is to come by.
No, I'm asking you a question. I'm not fighting over it. To be glad that Senator Shelby, the chairman, and myself as vice chairman, and key Republicans and Democrats rejected what your administration came up with for money. That wasn't fighting over it. We just said it made absolutely no sense, and we passed something which actually the president didn't sign. I'm asking you, is the virus being contained? That's an easy yes or no.
We're making every attempt to contain the virus.
Is it being contained? Because the administration says it is. Is it being contained? Yes or no?
We're making every attempt to try to contain it as much as we possibly can.
That's a no. On Friday at the CDC, as he's standing there wearing a campaign hat, the president said that anybody who wants a test can get a test. Said the tests are all perfect. Are they all perfect? Can anybody get a test who wants a test?
There are very few things that are perfect.
Can anybody? Okay, so the president was wrong on that. Can anyone get a test who wants a test?
The test is determined by a healthcare provider.
If a healthcare provider in Vermont wanted to get tests for 10 patients, could they easily get them?
They can order the test, yes.
Well, can they easily get them?
In some places it's easy, in some places it's more difficult.
But they want to get 500 out in Washington State where they've had it.
If you need one tomorrow, you can get it.
Okay, that's your statement. Remember, you're required to speak truthfully here under our law. You're saying that if they want to get one tomorrow, they can get it.
The tests are available here in Washington, D.C.
No, I'm not talking about Washington, D.C. I mentioned Washington State. I mentioned Vermont and elsewhere. Are you saying that somebody wants a test, they can get it tomorrow?
I said you, Senator Leahy.
No, I'm not asking about me. Come on.
That's what
Doctor,
I said.
you're making this stuff up. Be honest. Be honest with the American people. They're concerned. If somebody in Washington State, Massachusetts, California, Arizona wants to get a test tomorrow, can they get it?
Many of them can, yes.
Oh, many of them can. Okay. A little bit different than your earlier testimony. Now, you say this is like other viruses. Don't we have vaccines to prevent other viruses?
Well, when I talked about it being like other viruses and like the flu, I'm talking about the way it's transmitted and how you should conduct yourself in order to prevent it from spreading and being contaminated to other people.
I guess most people didn't gather that from your testimony. Over 500,000 people are homeless every single night in America. Many of them have no access to health care. Has HUD provided guidance to homeless shelters or state and local agencies that will make sure they ensure the virus does not spread among our homeless population?
Is there a question? I didn't hear the question.
Well, let me say it again slowly. What guidance does HUD provide to homeless shelters or state and local agencies that serve them to ensure this virus does not spread among our homeless population?
Thank you. We have sent guidance to, as I said, all of the public housing authorities and all of the people who are in contact with those that we serve in terms of how to get in contact with the local health providers in order to make sure that they have a plan if somebody amongst that group does in fact contract the virus.
Are you providing any resources?
We've made it clear to them that they can use the emergency solutions grants for that purpose, and there is also a way to use CDBG funding for that.
I would hope it's more available than the billions of dollars that HUD's received for Puerto Rico after that they've held back, even though had 5 hurricanes back to back, 3,000 people losing their lives and so on. And I will submit, Madam Chair, because my time is up, a question on Puerto Rico. I would actually like a real answer.